Surgical repair of a retinal detachment associated with a giant retinal tear. The case was begun with placement of a 41-band scleral buckle circumferentially around the eye. Core vitrectomy was performed and perfluorocarbon was injected. An infratemporal retinal tear was noted, along with the supranasal giant retinal tear. Meticulous shaving was performed along the horns of the giant retinal tear and around the infratemporal retinal tear and the rest of the retinal periphery. Additional PFL was injected, and endolaser was performed to barricade the infratemporal retinal tear and the giant retinal tear. A slow air fluid exchange was performed. It is important to be very patient with the air fluid exchange to avoid slippage. Silicone oil was then injected and the sclerotomies were sutured.